So today we're announcing 102 new COVID cases in the community. Of these, 94 are in Auckland and 8 of them are in the Waikato. So our total number of cases in this outbreak is now 2,260. Of today's cases, 30 are household contacts, 40 are yet to be linked to a current case. Now of yesterday's cases, the 60, 20 remain unlinked at this point, with investigations ongoing. But the focus, of course, is on identifying contacts and isolating and testing those contacts. Today we've got 46 people in hospital, our highest number in the outbreak to date. 45 of those are in hospitals across Tamaki Makaurau, and 1 is in Waikato Hospital. It's becoming increasingly clear, as has been the case right through the outbreak, that COVID is internationally a disease amongst the unvaccinated, and this is certainly the pattern here. The harms of COVID-19 fall much more on those who are unimmunised. A BMJ study which was released just last month, based on UK data, shows that of 40,000 patients hospitalised in the 6 months to the middle of this year in the UK, 84% of those people hospitalised had not been vaccinated, and only 3% of cases in hospital were fully vaccinated. Our own figures are similar here. We still have just 3 of our 188 people hospitalised during this outbreak, just 1.6%, who are fully immunised. That is at least 2 weeks since their second vaccination. And fully immunised cases make up just 4.5% of the total. The 8 new cases in Waikato are all around the Te Awa Mutu. 7 have already been linked to known cases. Waikato DHB is continuing testing across the region, and there were over 3,000 swabs taken yesterday. However, we would like to see higher testing numbers in and around Te Awa Mutu. Please get tested if you have symptoms, if you have a household member who has symptoms, or if in the course of the last week or so you have travelled in and out of Te Awa Mutu for work or for other essential activities. Whether you have symptoms or not, please get a test. One of today's cases in Waikato was a permitted traveller with an exemption to travel to Napier last Friday, the 15th of October. They were not a confirmed case during their travel and subsequently turned positive when they returned to the Waikato, where they are isolating at home. Their infectious period included the time they travelled to Hawke's Bay. There were 2 close contacts identified, one of whom lives in Wairoa. However, both have now returned negative tests, so there's no risk of onward infection there. The Ministry's updated guidance for allied health professionals working in settings outside of district health boards and hospitals, clarifying that they can provide services under Alert Level 3, that would be in Auckland and the Waikato. This clarification enables roughly 2,000 allied health professionals, such as physiotherapists, chiropractors, osteopaths, in Auckland, that's just in Auckland alone, to see patients who need to be seen face-to-face and to provide appropriate treatment. Of course, they will be screening patients for COVID symptoms, practicing COVID-19 IPC measures, including distancing where appropriate, strict protocols around infection control, PPE use, scanning, and so on. They will also keep providing telehealth services where that's most appropriate. So I do want to thank our allied health professionals who have had to adapt their practice right through the course of the outbreak, and particularly in Tamaki Makaurau over the last 2 months.
I know for people who watch the 1 o'clock briefing, it is something that you follow closely, and the ups and downs can be a bit of an emotional roller coaster. You will have heard from all of us who've spoken from here recently that we can expect to see case numbers rise. We do still want to keep them under control, and we're working hard to do that, and we thank Aucklanders for their cooperation in doing so. And as we head towards the long weekend, do ask Aucklanders to continue to stick to those Alert Level 3 rules. While keeping a lid on case numbers is important to reducing hospital admissions and reducing pressure on our health system, case numbers in and of themselves are not the only measure that we need to use going forward to assess the severity of the outbreak. It's anticipated that in the future 95% of people who get COVID could be treated at home with appropriate community care. And indeed in this outbreak, only a small percentage of those who've contracted the virus have ended up in hospital. The bottom line here, though, is that the vaccine is the key to keeping you, your family, and your community safe. We are facing this outbreak with higher rates of vaccination than perhaps others have in other countries. We are in a strong position, but we do need to build on that and see more people be vaccinated. So today, that means that we need to look at the number of cases and do all we can to keep them under control, but also keep an eye on hospitalisations so that we're measuring the severity of the outbreak there. The safety and health of New Zealanders remains at the forefront of our mind, and it is how we will continue to focus on managing the outbreak.